Are hospitals inflating the number of COVID-19 cases and deaths so they could get paid more? Doctor and Senator Scott Jensen of Minnesota says the American Medical Association is now encouraging doctors to overcount coronavirus deaths across the country.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much.
The fact checker reported that there is no evidence of fraudulent reporting and the figures are way out of scope that Dr. Scott Jensen has reported. But Medicare will pay hospitals a 20% add-on to the regular DRG payments for COVID-19 patients. That's a result of the CARES Act, the largest of the 3 federal stimulus laws enacted in response to the coronavirus, which was signed into law March 27th. But does the CDC new reporting guidelines artificially inflate COVID-19 death count?
The CDC counts both true COVID-19 cases and speculative guesses of COVID-19 the same. They call it death by COVID-19. They automatically overestimate the real death numbers by their own admission.
Until April 14th, the U.S. Centers for Disease Control and Prevention counted as COVID-19 deaths only in those in which the coronavirus was confirmed in a laboratory test, even as testing was not widely available. CDC National Center Health Statistics issued guidance to coroners and medical examiners who fill out death certificates to list COVID-19 as an underlying cause of death in the absence of a test, if the circumstances are compelling within a reasonable degree of certainty.
I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, COVID-19 caused death, end of quote, and quote, assumed death by COVID-19, end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19. To reiterate, if a patient tests positive for COVID-19 and dies from another cause such as pneumococcal sepsis, it may be considered accurate to say that person died with COVID-19, not from COVID-19. Yet the CDC guidelines list this case as one more COVID-19 death, and they go to the next questionable death. They label that as COVID-19, and it goes on and on. You could see how these statistics have been made to look really scary when it is so easy to add false numbers to the official database.
The day the change was announced, New York City's COVID-19 death tally soared by more than 3,700, where it included the total amount of deaths of people who were suspected of having COVID-19 but were never tested. Experts, however, agree that COVID-19 cases in the US are being undercounted, not overcounted, due to the lack of available diagnostic tests.